Welcome to Friday's edition of COVID-19. There has been a slight decline in new infections today, but with a week left to the start, that is, of our inoculation campaign, authorities are urging for continued public vigilance. And we have more on our vaccination efforts here and elsewhere around the world after the pandemic updates with our Kwon. So, as always, let's begin here on the domestic front for this Friday.
All right, Sunny, we are down by some 60 infections from yesterday as 561 cases were confirmed as of 12 a.m. this Friday. And that includes 533 domestic transmissions and 28 cases from abroad. And with that, the total caseload here in the country has surpassed 86,000. And we also have 1,550 fatalities, with 6 people having lost their lives in the past day. Now, although it is good to see a drop to the 500s from 2 straight days in the 600s, if we compare the figure to last Friday, we are seeing quite a surge here. And with that, the average number of daily domestic infections is at around the mid 400s, which is raising question over the wisdom of recently eased social distancing measures. Speaking of social distancing, regarding that, the government has introduced an encrypted numbering system this Friday that citizens can use instead of their phone numbers at establishments where entry logs are required. Now, with a week left until vaccination kicks off, the government is in the process of drafting a revision to the social distancing measures, which would focus more on autonomy and individuals' responsibility. But experts are warning that there could be a rise in cases over the aftermath of family gatherings after the Lunar New Year holidays, that is, or Seoldal, and also the cluster infections that we are dealing with in the country. Now, speaking of which, the country this Tuesday has, again, most cases here concentrated in the metropolitan region, with over 400 cases here and also double digits in other places. And all 17 provinces or major cities have reported at least 1 case this Tuesday. And here we see some cluster infections, 4 major clusters with over 100 cases each. Here at major hospitals in the capital, Seoul, here the Suncheonyang University Hospital and also the Hanyang University Hospital in the capital. Then we have major clusters here in Namyangju, as well as in the city of Asan in Chungcheongnam-do province, and those both at factories. So, and because of that, the government is calling on efforts
to ensure more safety there, right? So I was just going to ask you about that. Please tell us about the safety efforts then at these large establishments. Sure,
Sunny. The government will strengthen antivirus measures at manufacturing plants and construction sites. The Labor Ministry is expected to conduct inspections at some 1,000 establishments vulnerable to cluster infections. And here is a senior ministry at the Health Ministry on more details this morning.
Inspection will be focused on the wearing of face masks, proper ventilation, as well as compliance to prevention measures at cafeterias and dormitories. And violation will be met with fines and other penalties for the business in question.
Son also mentioned that many foreigners were infected at the factories in question, and that undocumented foreign workers were in the blind spot of the country's containment efforts. Officials stressed that in the fight against COVID-19, no one will be discriminated against, meaning anyone who shows symptoms of the virus needs to get tested no matter their status. And from foreigners now to the global figures, we see that the world has a total of 110.8 million infections and over 2.4 million fatalities, with more than 10,000 new deaths reported in the span of 24 hours. And if we take a closer look at some major outbreaks, we see that Brazil here has become the 3rd country around the world to surpass 10 million infections. And despite some decline declines in daily caseloads in many countries around the world, variant concerns keep growing, including in neighboring Japan, where a new variant likely to be more contagious and also resistant to vaccines has been detected. Also growing concerns over variants in Europe and more challenges there, which our Song-yeon is going to go into the details in a bit. And I'm going to be back on Monday because on Fridays we do not have an afternoon briefing on the coronavirus situation. See you back on Monday, Sunny.
Right, so thank you for that. I'll see you on Monday. Right, mutations of the coronavirus may pose a risk to those who have been vaccinated and even those who have recovered from COVID-19. Having said that, experts in Europe are seeking a joint effort to better tackle the related challenges. I have Kim Song-yeon here in the studio with me with details on that. Welcome, Song-yeon.
Good afternoon, Sunny.
Right, then let's begin with this latest united stance over in Europe.
Right, so variants, as we know, are ringing alarm bells across the entire world. And we just did hear about the worrying developments in neighboring Japan from Seoul. Now, over in Europe, the EU has launched a new program to study these new variants in hopes of developing vaccines that can better deal with them. Now, there are concerns that the new variants could trigger another surge in COVID-19 cases. And with the mutated strains continuing to spread across Europe, the EU is now preparing stiffer countermeasures. The president of the European Commission said that the new program will bring together health authorities and laboratories and will operate on an independent budget. Commission President Ursula von der Leyen talked about the program dubbed the HERA Incubator, which was launched this Wednesday. She said the program would bring together science, industry, and public officials to better prepare Europe against the threat of new variants and allow the EU to leverage all available resources in response to this challenge. Now, despite the hopes offered by this program, von der Leyen warned that new and more vaccine-resistant mutations could emerge in the months ahead.
There are going to be more infections, and that will mean more variants. And these variants could be more resistant to existing vaccines.
Now, she elaborated on the specific steps the Commission plans to take, from funding new research projects to speeding up the approval process and ramping up production. She emphasized that the new coronavirus variants spreading all over the world represent a paradigm shift in the fight against the virus that requires new strategies.
Right, Song-yeon, staying in Europe, Germany, I hear, had a grim forecast about the UK variant.
Yes, Sunny, worries are growing, especially because these variants, they are more contagious. It seems now German Minister of Health Jens Spahn expressed great concerns over the spread of the UK variant. Now, in light of the rapid transmission of the new variants, the German health minister noted it remains important to be very careful with lockdown relaxations. And furthermore, he said the UK variant is very likely at this point to become the most dominant strain in Germany in the near future.
As has been observed in other countries, the share of infections with this variant of the virus doubles around every week. We must expect that variant to soon become the dominant one in our country as well.
And in particular, Spahn stressed that rapid testing was an important tool in the fight against the pandemic. The German government has already expanded the use of rapid antigen test kits and is now conducting tests at nursing homes and hospitals as well.
Meanwhile, Song-yeon, I understand the South African variant, for its part, is challenging Pfizer's, or the efficacy, that is, of Pfizer's vaccine.
Right, Sunny. This is according to a lab study conducted by Pfizer and BioNTech. It does appear that the South African variant may reduce the generation of protective antibodies from their vaccines. Now, Pfizer said on Wednesday that the South African variant could reduce the antibody protection of its vaccine by 2/3, and it is not clear if the shot will be effective against the mutation. The study found the vaccine was still able to neutralize the virus, and there is no evidence so far from human trials that the variant reduces vaccine protection. Still, they are talking to regulators about the developing an updated version of their mRNA vaccine or a booster shot if necessary.
I see. And speaking about a booster shot, I understand Microsoft founder Bill Gates believes a third shot may be needed to combat the variant.
Yes, Sunny, Bill Gates is talking about that third shot indeed, and he said it was especially necessary to keep patients of the new variants from falling seriously ill. The billionaire philanthropist's comments came on Tuesday amid growing concern that current vaccines are less effective against the South African and Brazilian variants, and he added that the most important question at this point is whether we need to maximize the coverage of our current vaccines or administer a third dose or develop a modified vaccine. Now, Gates is funding studies in South Africa to determine whether the AstraZeneca, Johnson & Johnson, and Novavax vaccines were as effective against the more contagious new variants. And he further noted that if the coronavirus is not eradicated, additional shots may be necessary in the future. Now, back here at home, the Korean government announced yesterday that since February 8th, which is last Monday, samples of the UK and South African variants have been sent to local labs for research on vaccines and treatments. Now, with worries mounting over a possible fourth wave of infections come March and April, the government says starting next Wednesday, all overseas arrivals will be required to submit negative PCR test results upon entering the country.
All right, Song-yeon, thank you very much for that broad coverage. See you next week.
The pleasure is mine.
Right, a growing number of pet owners here in Korea have been asking about the safety of their furry friends amid reports of animals testing positive for COVID-19, including 2 such cases here in Korea. I have Chun Song-cho standing by. Hello, Song-cho.
Good afternoon, Sunny.
Right, Song-cho, so where are you reporting from today?
Well, I'm at a vet clinic here in northern Seoul to get to the bottom of it all, COVID-19 and animals. Well, if you have pets, you probably can't imagine life without them. I mean, I can't without my pet. From companionship to unconditional love, they're always there for you, and they can even help us reduce anxiety and fight depression amid COVID-19 pandemic. However, since the beginning of the outbreak of COVID-19, scattered reports of animals across the world contracting the virus have really raised fears and concerns that our pets and farmed animals could be a reservoir for the disease. Just last month, in northeastern city of Jinju, South Korea's first COVID-19 case involving a pet was reported, and then last weekend another cat tested positive for COVID-19 here in Seoul. So I think it's safe to say that human to animal transmission is possible and animals can develop COVID-19. But our question is, can animals pass the virus to us? And do we have to keep our masks on and keep distance from our furry friends even at home? So that's the question that like to be answered today. So that's what I'm here for. Dr. Kim Do-yoon is here with us joining our show this afternoon to answer all the questions for us. Good afternoon, Dr. Kim.
Good afternoon.
Okay, so just for information, here is Taebeki, my 1-year-old Jindo mixed dog. He's looking very timid and scared, but he is here to help us out with the demonstration. So, doctor, we've been hearing reports of animals contracting the virus and testing positive here and elsewhere in the world. So how seriously should we take the news, and how bad is the situation right now?
Last year, 52 dogs and 72 cats worldwide were reported to be infected with COVID-19, according to the Korean Disease Control and Prevention Agency. The number is still increasing, and several animals like lions, tigers, and gorillas have tested positive for COVID-19 in other countries. And 2 tiger cubs in Pakistan died from suspected COVID-19 infection.
I see. So let's address the elephant in the room. Can animals transmit the virus?
So far, there have been a few cases of transfer from confirmed people to their pets. But the risk of contracting COVID-19 from your pet is estimated very low. Currently, there is no evidence that animals plays a significant role in the spread of COVID-19 to people in other countries. However, more studies are needed at this time to to understand infection from animal to animal.
All right, so you're saying that the chances are very low, but I still don't want Taebegi to get sick from COVID-19. So what are the symptoms that that I can look for in Taebegi?
Well, the confirmed cat had vomiting and depression. According to the reports, infected animals had symptoms like coughing, diarrhea, anorexia, and lethargy. If a confirmed person's pet has symptoms that I just mentioned, they should have their pets checked out as soon as possible.
All right. I know Seoul officials just started offering free COVID-19 tests to all cats and dogs if a confirmed owner requests them to be tested. So what kind of tests do animals have to go through? I mean, does it involve a long nasal swab like humans? Because I know Taebegi won't be that very keen on that idea.
Let me show you. It's kind of similar to people. I can get a sample by doing like this. And this sample will be delivered to the proper authority for a PCR test.
All right, so it's pretty much like humans. So just keeping my fingers crossed that Taebegi won't have to take that test ever. So last but not least, many pet owners out there, including me, are in dire need of advice from professionals like you, how we can keep our furry friends safe from COVID-19. So what precautions can we take?
Well, I can tell you at least 3 things. First, wash your hands with soap and use hand sanitizer before and after contact with pets. Second, keep a 2-meter distance away from other people and pets while walking outside. And last, if owners were suspected of COVID-19, then avoid direct contact like touching, hugging, and sharing food.
All right. Thank you so much for your answers today, Doctor. There was a lot of help. And thank you, Taebek, as well. All right. So Seoul officials recommend that people who are suspected or confirmed to be infected with COVID-19 to avoid close contact with their pets and have another member of their household to take care of them. And pets who tested positive for COVID-19 have to be isolated in a separate space for 14 days, just like humans have to do. And if you have COVID and if you feel like your pet is showing symptoms, then you definitely have to contact the KDCA immediately. So yes, even our four-legged friends are not safe from COVID-19. So remember, your continued vigilance with masking, social distancing, and hand hygiene is not just for the safety of you, but it's also for the safety and health for your pets. This has been Chun Sung-cho reporting live, and back to you, Sunny, in the studio.
All right, Sung-cho, thank you very much for the coverage, and have a safe weekend, both to you and Taebek. Right, on the international front, COVID-19 infections have been declining in the US. And for more on the situation there, I have Jamie Reno, an investigative reporter at Healthline, joining me now. Are you there, Jamie? I understand we have to connect him. Jamie, hello?
There we are. Good to see you.
Right, Jamie, let's begin with an analysis of the downward trend in COVID-19 infections over in the US.
Yes. It's gone from some 300,000 daily to somewhere around 50,000, and that's obviously good news. There are multiple reasons for it, but primarily it's because of the rollout of the vaccines. We're seeing pretty good response to the vaccine rollout. Something like 27 million Americans have received a first dose of a vaccine. And about a little more than 6 million have been fully vaccinated in the U.S. And that's, those are good numbers, but, we have a long way to go in the United States. They're still pretty good at mask wearing and social distancing. But there are pockets of this country where they are sort of in denial about the seriousness of this virus. But generally speaking, I would have to say that it's good news. The vaccines are helping to bring this down, no question.
Right. Jamie, President Joe Biden has forecast that all Americans can get a COVID-19 vaccine by August this year. How likely is this prediction?
Well, it's still likely. I think it's very likely to happen. Well, he's basically saying that he can finish it by August, but there have been some major, logistically that could be really difficult, especially with the cold. Like, imagine what's happening in Texas right now, where, I'm sure you all know, the whole state is virtually frozen. This is causing a closure of several vaccination locations, for example. People are not leaving their homes at all, even to get vaccinated. So there's some hurdles with that goal, but I think it is realistic. I think it is a realistic possibility still.
Right. Jamie,
Hopefully.
I understand there's also been some controversy over the priority list for vaccines. Could you tell us a bit more about this?
Yes. So there's an ongoing debate, Sunny, about the eligibility. Who should be eligible? And I wrote a story for my last story for Healthline. Looked at this, and we're talking about, in the United States, primarily it has been an age-focused eligibility. So in other words, people 65 and over are able to get the vaccine if they have access to it. And there, of course, the frontline workers, healthcare workers as well. But then it becomes a real debate. I personally have a stake in this because I'm a cancer survivor, and that's what prompted me to write this story. I've interviewed many people, and not just cancer, many different underlying health conditions. There's my story. People 16 to 64, there are many different ailments and illnesses that can make you more vulnerable and more immunocompromised and of much greater risk. My own oncologist wrote a letter for me to try to convince them to give me the vaccine, but I've not been able to do it. However, in New York, Governor Cuomo has lifted that and made it 16 to 64 people with underlying medical conditions, and now Gavin Newsom, the governor in California, is doing the same thing. He's beginning March 15, I believe, people who have underlying conditions will have access to a vaccine. However, it's going to be a madhouse as people, it's going to be a much larger population now seeking the vaccine. So
Right.
We'll see what happens.
Jamie, 7 new variants of the coronavirus have been identified within the U.S. How are authorities responding to the findings?
Yeah, I mean, it's obviously a concern. The one variant, the first discovered in Britain, has infected something like 1,300 people. It could be many more than that. Obviously, we think it is more than that. This is in 42 states where this is happening. It is essentially, Sunny, what we have now is essentially a race between the vaccines and the variants. And who wins that race is anybody's guess. The good news is that President Biden is on top of this. He just yesterday, on Wednesday, pledged $200 million to, and that sounds like not a lot of money, but he's beginning to really focus on the variants, which I think the whole world has to do. And some of you early reporting talked about that today. $200 million to better identify the emerging variants and what they can do, and just to have an awareness that they're out there is important,
Right. Jamie, you mentioned New York Governor Andrew Cuomo, and I was wondering whether you could tell us a bit about the investigations into allegations of hiding COVID-19 fatality numbers at nursing homes by his administration.
Yeah, that was one of my other recent stories that I think you and I talked about also, the nursing home situation, which of course was ground zero for this virus for many months in the United States. Governor Cuomo was a beloved figure during this pandemic with his daily announcements, which people really admired him for. This official number of nursing home deaths now in New York has gone from 8,500 to 15,000. The full story is still coming out, but the FBI and prosecutors are looking into this, and Brooklyn prosecutors and FBI, federal prosecutors. This is a serious thing when you hide numbers like this. It happened, frankly, in the previous administration, that kind of thing was happening, but we hadn't really seen much of that on the state level. This is kind of a new and rather chilling. I have respect for Governor Cuomo, but this is a little troubling. We'll see what happens.
Right. Meanwhile, come Saturday, Jamie, that is tomorrow, the Biden administration marks its first full month in office. What has been the public response to the new administration's COVID-19 containment efforts thus far?
I think overall very positive. I mean, I think Biden said this week that, you know, there's going to be by July, everybody will have an opportunity to be vaccinated. He's definitely stepped it up. He's focusing, and I think what really is important to me and to many people who care about this issue, he's relying on the science now. He's focusing on the facts, the science. You know, he's also being very soft-spokenly trying to get the country to come together. That's a difficult thing, you know, in any country, frankly, but he's trying very hard to do the right thing and do it quickly. The issue, of course, is that as many as 30% of Americans still say they're not going to do the vaccine, participate in the vaccine yet. They're not going to do it, including 30% of our military, which really kind of surprised me. But that's just something that the president, I guess, has to deal with. We're never going to reach herd immunity unless we get, you know, 70 to 85% of Americans vaccinated. And so we'll just have to wait and see whether that happens.
Right. All right, Jamie, thank you very much for making the time to join us live at this hour with your thoughts.
My pleasure. Good to see you.
Right, and to our viewers here, we do apologize for the lip sync error in our connection with Jamie.
정부는 전 과정에 걸쳐 빈틈이 없도록 철저히 준비하고 있습니다. 국민들께서는 정부를 믿고 안내해드리는 접종 계획에 따라 적극적으로 참여해 주실 것을 당부드립니다.
7 days and counting to the launch of our vaccination drive, and today we take another look at related efforts here in Korea as well as elsewhere around the world to ensure an effective campaign. I have Dr. Yu Byung-wook from Suncheon University Hospital. Welcome back, Dr. Yu. It's been a while. And joining our talk virtually is Professor Son Ho-jun from Johns Hopkins University. Hello, Professor Son.
Hi, Sunny. Thanks for having me.
Right. Dr. Yu, our campaign next Friday will kick off with residents and staff members below the age of 65 at nursing homes receiving the AstraZeneca vaccine. Most residents there, though, are above the age of 65. Does this reality worry you?
Well, someone who worry about it because the main victim is more than 65 years old, but we can think a little differently because government, why they choose less than 65 years old first of the steps to who care of the more than 65 years old, because they are kind of guard, like we can tell shielding, because people who are staying in the long-term facilities, they couldn't move out themselves. They need someone's help. So if we make the shield against the COVID virus from the outside of society into the long-term facilities, so this is kind of first, kind of choice and strategy, because people are worried. I believe that AstraZeneca one and other one still used when more than 65 years old with the safety and efficacy. But some evidence is not enough. That's why other countries in Europe, they not approve about the more than 65 years old. That's why Korean government finally choose kind of different strategy. Let's start at less than 65 in the facility care the steps, and who are going to be well effective, make the first shield. At the same time, we show them which is safe, and we can go into the more than 65 years old person who not going to register having vaccination.
Right. Right. And staying with that, Professor Son, the World Health Organization has approved the use of AstraZeneca's vaccine on all aged 18 and above, unlike a few countries, including Korea, Germany, and of course, France. What are your thoughts on this?
Yeah, so it's important to note that this is a cautionary recommendation issued by WHO. Any agency reporting policies, guidelines are always cautionary when reviewing these evidences from these trials. Also, just to say, Dr. Yu also mentioned that in Europe, before the European Medical Agency approved emergency use authorization for the AstraZeneca vaccine for 65 and older, there has been a bit of controversy around this matter as well. And to understand this, it's important to understand and inform the viewers on how policy recommendations are made actually. And these are actually made based on empiric evidence that has been presented through clinical trials. And clinical trials have very specific research questions and aims to demonstrate, and they recruit these patients in the specific target population. And also to address, and these trials also have significant logistical, financial, and analytical limitations when in addressing these complex and moving and wide-range policy recommendations that needs to be made on spot and moving like in the pandemic era. And this can't be really answered through a single trial. So oftentimes multiple trials are being planned and actually being conducted. And this is the same for the trials specifically for the very elderly people. And in the response for the Korean government, this is not to say that there is not an evidence for the elderly population for the vaccine effectiveness in this group. But as Dr. Yu has mentioned, the authorities have felt that this is not enough. There's not enough strong evidence at this time, considering the Korean circumstances. We know that our situation, of course, the daily level is fluctuating above 600 now. 500 and 600, but it's much, much better than many other settings in Europe and US. So, and they are really approaching this more cautiously, and caution is really important to think about here.
Right. Dr. Yu, which is why there has been talk about setting up mobile inoculation units to travel to nursing homes with the Pfizer vaccine. How feasible is this plan given the cold chain requirements of this particular vaccine?
First of all, under Korean regulation of law to vaccination, is not possible. Why? Because all persons should be visited in the hospital under registered. But probably it can be modified this law to can be. So a couple, 10 years before flu vaccination, we do in some of the groups out of the hospital. So remote, we can visit somewhere. But how we can handle it after vaccinations happening? So especially for COVID-19 vaccination, we need more cautions. Also, especially for the very extremely low temperatures one, when we move to the other place, so it can be a little bit complicated, especially for the who are staying in the resident, as who are vulnerable people are. So we have to be considerate about it first, and then this is kind of alternative, because if we don't have enough evidence, what Professor Son mentioned, so I believe that end of March, we got enough evidence about the AstraZeneca and KDCA to the announcing again to the permit to start at 65 years old. But if any possible we cannot do, we can using the Pfizer one for that way. But we have to bring into the facility who are safer area with watching with the doctors and nurses, the medical staff, to be sure to be their condition is help to nothing happen.
Right, that's true. Professor Son, authorities have vowed the inoculation of the elderly, that is those aged 65 and above, will not be pushed beyond April. What are your thoughts?
Yeah, so this is somewhat puzzling and concerning on my end, because we've done really well in terms of preventing using social distancing, active testing and treating of potentially people with symptoms and contacts of COVID-19 cases. And the fact that we were a little bit delayed in terms of negotiating and securing vaccines probably have attributed to this effect. But I can't really never emphasize the importance of at least there's roles on both ends, the government as well as us, for general public we should continue to adhere to the very basics of the COVID-19 prevention. And I've heard that the other panels earlier this week on this very new show mentioned that the 3 W's of washing your hands, wearing your mask, washing your distance. And this is, I think, the minimum that we can do to protect the elderly and high-risk people in our society until the vaccines become available and we can increase the coverage. On the government side, Dr. Yu also mentioned about the logistical challenges, and securing a certain number of doses doesn't necessarily mean that all of doses are going to be administered to the patients and to the target populations. So, and anything can go wrong in between the production and administration process of vaccination. So the government really needs to think and really effectively implement strategies to vaccinate people in the target groups. And then ultimately, there are a lot of misconceptions, misinformation, and false information about the vaccine safety that's already also circulating here in Korea. So we have to really think ways and innovate ways to disseminate correct and fact-check information about these vaccine safety, so that there is going to be a good public response in vaccination and participation in vaccination, so that we can get closer to the herd immunity goals when vaccine becomes available to us.
Right. Let's take a moment now for a glimpse of the vaccination campaign elsewhere. The United Arab Emirates has the second highest vaccination rate after Israel. And I have Rebecca Ann Proctor, a journalist at Arab News, on the line with details on that. Welcome, Rebecca.
Thank you, Sunny, for having me.
Right, Rebecca. So the plan is to vaccinate half of the country's population of some 9.6 million within the first quarter of this year. How is this plan proceeding?
Well, thanks again for having me, Sunny, on the show. As you said, the UAE continues to be second only to Israel in global vaccination administration. And so far, it has administered 5 million COVID-19 vaccine doses with a distribution rate of 50.61 doses per 100 people. And moreover, the rate of the distribution doses has climbed consistently since the launch of the drive in December last year. So we can say that it's going really, really well. There's vaccination drives open across the country in every single emirate. Most people I know have already been vaccinated. And it is estimated that more than 1.5 million of the population are now fully vaccinated. And as you rightly said, the UAE has plans to vaccinate half of the population by March. So it's really, for a population that isn't, as you said, 9.5 million, it's well underway to hopefully reach that mark. Regardless, there has been over the last few weeks, despite the success of the vaccination campaign, the number of new cases do remain high, probably because there are many variants now in the UAE. The UAE did open its borders and continues to be one of the few countries that has open borders right now. But regardless of that, the UAE government is being extremely vigilant in terms of our health and safety. So we do have new restrictions in terms of social distancing. There's been cancellation of events. So regardless, while we are not in a lockdown again, and the vaccination drive is really pushing ahead, even if cases do remain high, they seem to be leveling off now. And our health and safety obviously is the most important in terms of this, in terms of going forward.
Right, Rebecca. Rebecca, I believe our Dr. Yu here in the studio has a question for you.
Hello, Rebecca. I have one question. I heard that UAE have many opportunities having vaccination from the range like Pfizer, China's the Cynopharms, and Russia's specific victories. You have it. Do you have any data can share to us about the safety and efficacies?
Yes, thank you so much. Well, in the presence of local data, for the Chinese and Russian vaccines, there are now 4 vaccines available in the UAE. The Chinese Cynopharm vaccine is the most widely used vaccine in the UAE. The UAE Ministry of Health has said that it has an overall 86% efficacy rate, but offers 100% protection from moderate and severe forms of COVID-19. And more than 1.8 million people in the UAE have already received the Cynopharm vaccine, which is available for free to all citizens and residents, which is more than actually quadruple the per capita vaccination rate in the US. There's also the Russians Sputnik V vaccine, which has undergone phase 3 trials in the UAE, and which suggests that it is 91.4% affected. The vaccine was approved for emergency use at the end of January, making it the third vaccine after Cynopharm and Pfizer for use in the UAE. There's also the Aztec vaccine also available. But like Cynopharm, the Russian Sputnik vaccine is delivered in 2 doses, and it is also named after the first Soviet space satellite. So that is, those are what's available right now. So people have they have these options to choose from.
Right.
And yeah.
Professor Sohn, is there something that you would like to ask Rebecca?
Yeah, no, hi, Rebecca, and thanks for sharing the news from the United Arab Emirates. So based on my knowledge, and I think many of the researchers in my field in public health are having same questions about the effectiveness of the evidence that's available for Sinopharm vaccine of China. So, and the existing evidences for the Sinopharm effectiveness is highly variable, despite the information that you've shared with us. I think it ranges between 50 and 90% in the very controlled phase 3 clinical trials. And then, in the scientific community in general, there are credibility concerns for this vaccine in terms of both the effectiveness and the safety. So, but given the sheer volume of the vaccine that's available to UAE residents, it's probably that because of the volume, they're making that choice to vaccinate themselves with the Sinopharm. But how do people perceive the government's decisions for Sinopharm to be approved? And then are there any public concerns over taking this vaccine?
Well, thank you. Yeah, so far I haven't, we haven't really heard any, and I haven't heard any negative responses about the Sinopharm. I think there's obviously been concerns, as there's been global concerns over, as you've said, sort of credibility of the data of efficacy rates, which obviously vary. It's really difficult to get sometimes the most accurate statistic rates. But that said, people have trusted the government's decision, and most local Emiratis, UAE residents, and even tourists are coming. There's, some tourists are coming and they get the vaccine if they're able to stay here for a certain amount of time. So people have been taking it, and so far I haven't heard any negative feedback. There are moderates. I mean, there's very mild side effects, and people who've taken the first or second doses, sometimes, they say that they have mild symptoms, but then these go away. So for that, yes, I think it's sort of the number one kind of distributed available vaccine that we have here in the UAE, and people have trusted what the government is putting out there.
I see. All right, Rebecca, as always, thank you very much for making the time to join us live with your thoughts.
Thank you.
Right, back here in the studio, Dr. Yu. Now, this is something that Professor Sohn mentioned, but misinformation is expected to disrupt vaccination efforts. What are ways to perhaps deal with this reality?
Since when I was young, I believe the pen is more stronger than gun. So this is what I believe 100%, which means who writing the wrong way with the pens can kill some people. Governments must be strongly put on the penalty who use this weapon the wrong way in strong voice, because you are just tricky, the funny one word can kill the million people. So please don't do, because your small trick can be 3 billion people.
That is so true. Meanwhile, Professor Sohn, what are some of the possible side effects after inoculation, and how should we respond in the wake of such cases?
Yeah, so these side effects are the range of different side effects, and the diversity of side effects are definitely at the source of the concern and misinformation, obviously. But just to say, biologically speaking, the most credible so far vaccine, the mRNA vaccine, are particularly produce strong immune responses, and that's potentially an important biological risk factor in generating these the more significant side effects than your typical flu shot. So there are going to be more than typical flu shot. That's important to understand. But these are not, most of these side effects that's been reported are in the US, officially infection and site pains, fatigue, headache, and muscle pains are the most frequently reported non-major side effects. And also the other thing to consider is that these mRNA vaccines that require 2 doses, the second, the booster shot, it seems to trigger more frequent non-serious side effects than the first one. The other thing that's more concerning in terms of the side effects are the rare allergic reactions. And these are actually being very actively monitored by the government authorities and around the world. Scientists believe that these are more or less attributable to the inclusion of polyethylene glycol, PEG, which are the lipid nanoparticles, and that are known to cause these serious allergic reactions. And these have been included in other products, and other products also have caused allergic reactions. So if you're taking a vaccine but have had previously experienced allergic reactions to other vaccines, it's important to take a bit of caution when taking a COVID vaccine. This doesn't mean that you shouldn't take it, but also government authorities have been recommending and setting up procedures so that you remain in the vaccination site for at least 15 to 30 minutes so that they can monitor your side effects immediately.
Right.
And then also there's a reporting system for you to report any side effects. And if you do experience these side effects after this monitoring period, it's important for you to seek professional care.
Right. Meanwhile, Dr. Yu here in the studio, a very quick question then. What are your thoughts on the government's preparations thus far for their inoculation campaign?
So yesterday, the government announced about how we can prepare and practicing. So 4 centers is set up already. 250 centers can handle it with the Moderna Pfizer one, which need extremely low temperatures. And the 10,000 center will take care of the people with the Astra and the simple one we can do. But from the beginning, we cannot be perfect. Hopefully the people please don't do the criticize about it, because when we do, we're going to be perfect to take care of the patients well.
Right. All right, Dr. Yu, as always, thank you very much for your insights. And Professor Sohn, thank you very much for your thoughts today. To our viewers here, we also apologize for the lip sync error in our connection with Professor Sohn. Now, we are heading into the weekend with daily numbers relatively high, as our consul mentioned earlier, so do seek to abide by social distancing measures this weekend. Having said that, have a good weekend and see you on Monday.